So, Dr. Jayasekera is the Director General Health Services in the Sri Lanka Navy, and he is in the Board of Management of the Sri Lanka Navy, and also he is the member of the National Health Development Council under the Ministry of Health. He has wide experience on social medicine, and he has presented various papers, and incidentally he and I are co-mates in this very prestigious institute, KDU. So let me warmly invite Dr. Nicholas Jayasekera to present his paper on combat exposure and cannabis use. Are they associated?
Thank you very much, sir, for those very kind words. Now, you got to wait a couple of seconds because the question that was posed has to come up on screen. The question is, combat exposure and cannabis use, are they associated? So this, the answer to the question was looked into a few years back by a team of people, including myself, and two renowned professors, that is Professor Varuni de Silva and Professor Raveen Hanwella, who are the consultant psychiatrists to the Navy. Yeah, so there you are. That's the question. And I presume that you are not read the abstract. So we can look for the answer. Yeah, so the first question in this thing is, what is cannabis? I'm sure that needs no introduction. It is also called marijuana. Some call it joint, grass. And in Sinhala they call it ganja. Some people call it mal. Susti, and you name it, so many names. In essence, it is a psychoactive substance derived from the plant Cannabis sativa. The key ingredient out of 483 ingredients that are there in this plant that is there is a product called THC, which is the main ingredient that causes the effects. And the problem is, regular cannabis use leads to dependence, or what is commonly called addiction. Now, when you take the global cannabis use situation, it is alarming. Around 125 to 200 million people use cannabis, ranging from about 3 to 5% of the global population, aged 15 to 64. Quoting 2009 figures. Then when you take the Southeast Asian region, there are about 16 to 28 million people. There again about 2 to 3% of the population using cannabis. Now in Sri Lanka, we don't have any published studies done, but there's a guesstimate by the UN which says there are about 600,000 users in Sri Lanka. And the problem is, very clear when it says that 114,390 kilograms was seized by the police in 2010. And a study done on inmates in the prisons has shown that 80% of those imprisoned for drugs and related offences used cannabis. Now, when it comes to the military, which is what we are all interested in, the French army, in a study, showed that 18.5% of French army men used cannabis. Now here the definition of use is very important. When you say use, what they define is use it at least once a year. The minimum of at least once a year. And then there is also a concept called regular use, which says smoking at least 10 joints per month. That is regular use. And that in the French army was 8%. Then when it comes to a more European place like Canada, more distant place like Canada, it is 14%. Reported use is 14% based on studies. Then in Brazil, lifetime use has been observed to be 8%. Sri Lanka, as I told you earlier, there have been no reported studies. Right, now I wish to quickly go through the effects of cannabis, which some of you might know, is high mood or euphoria, relaxation, and increased appetite. The side effects of cannabis is also disturbing. It is short-term memory, low short-term memory, impaired motor skills, which means you can't drive, anxiety, visual and auditory hallucinations. And this is a pictorial representation of that. So a guy who has taken cannabis will have red eyes, he'll have a dry mouth, a cold or warm skin, a rapid heart rate, and of course, relaxed muscles. Now, what is the significance of this study? I told you some of the significance earlier, but to add to them, the important thing is the pattern of substance abuse starts with alcohol and tobacco. Then people move on to cannabis. Then after that they move on to the harder stuff like LSD, heroin, IV drugs and so on. So that's the danger. Then, as I said earlier, the users are more likely to use other illicit drugs like IV drugs. And also, if you have a tendency to psychosis, that is the major psychiatric illnesses like schizophrenia and depression, then this will be precipitated by cannabis use. So again, I argue that in Sri Lanka it has not been studied earlier. So the objectives of the study were, one, to assess the prevalence of cannabis use in the Navy, and then to identify any relationship between cannabis use and socio-demographic characteristics, other substances like alcohol and tobacco, and combat exposure, which is the question I raised at the beginning. The methodology we used was a cross-sectional study among representative samples of the special forces and regular forces. We have in the Navy the special forces, they are called the SBS, so we used a sample from that, and the regular forces. The sampling was random, and we had 259 subjects from the SBS and 412 subjects from the others. What we meant by deployed was a period of 1 year up to the end of the war. That is, people who were deployed in combat areas 1 year before the end of the war were the people who were taken. And cannabis use, as I said earlier, was defined as at least once a year. Using cannabis at least once a year was the thing. And the timing was 3 months after the cessation of hostilities, and the study was done in 2009. And we didn't want to reinvent the wheel. We used a UK-developed questionnaire that was used after the Iraq war. The same questionnaire was used with a little modification. Results. The prevalence of use was 5.22%. Now, the interesting fact is that it is less than reported among other military in the world. If you remember that it was something between 8 to 18%. So Sri Lankan military has a prevalence rate lower than that. There was no significant difference among SBS and other users. That is, when you take the special forces and the other forces, there was no significant difference between using those two groups. And there was no significant association between cannabis use and combat exposure. So you need not worry. There was no significant difference. Right. Then a few other findings. There was significantly higher risk of use associated with hazardous alcohol use. That is, if people used alcohol, there was a more possibility of using cannabis. And the OR there is, the odds ratio, as you may call it, was 4.74. That's a very strong association. Then again, with less education, the troops used to take more cannabis. So people with O-level or less used more cannabis, and that again with the association that was quite significant, OR of 4.2. Then the younger troops, that is age between 18 to 24, smoked cannabis. And then, understandably, the people who were unmarried also used this, but of course the association was less, it's only 2. And then, interestingly, smoking, current smoking was associated, but very weakly associated with cannabis use. That's a very strange finding, because people will assume that normally people who smoke will also smoke cannabis. Right, coming on to the last slide. So, therefore, the findings are consistent with the observation that overall substance use in the Sri Lankan military is low. But I must admit that one limitation would have been that we conducted this study just after the war, and there might have been problems of access to this substance in the operational areas. That may have been one limiting factor. And also, as I said earlier, alcohol use and to a lesser extent smoking is also associated with use. And lastly, unmarried, younger and less educated men were more at risk. Special forces and combat exposure is not associated with higher use. These are the references. Thank you very much.